Good afternoon. Welcome to the Health and Adult Social Care Scrutiny Panel. Unfortunately, Councillor Lawson is unable to attend the meeting today, so the first point of order is going to be to appoint a chair. Do we have nominations, please?
Can I move for Councillor Armour?
I'll second that.
Thank you. Thank you. Councillor Armour, would you like to make your way?
Right, thank you, colleagues. We'll move to excuse me, item 1, which is membership of the panel. I'm Councillor Bill Armour, standing in for the absent chair. I would like to start there.
Thank you, Chair. Councillor Eric Firth, Dewsbury East.
Helen Clay, Valancourt T.
Councillor Habib Saman, Batley East.
Councillor Alison Munro, Almonbury Ward.
Do we have any apologies?
We have received apologies from Councillor Joe Lawson, Councillor Darren O'Donovan and Kim Taylor Quapty.
Thank you. Item 2, declaration of interests. Do any members have items to declare, interest to declare?
None, Chair.
No, it's, there's no one speaking up, so no interest to declare. Item 3, admission of the public. This is an agenda item which will take place in public. I'm not been informed of any reason for that not to happen. So we will be in public session. Thank you. Item 4, deputations and petitions.
None received, Chair.
Thank you. Desperately turning the page over. Item 5, public question time. Do we have any members of the public to questions?
None received, Chair.
Thank you. So we move on to the main substantive item, which is the CQC's inspection report and rating for adult social care, which I assume one of our officer colleagues will be presenting. If you'd like to, please.
Thank you, Chair. I'll just do a round of introductions so you know who's in the room with us. So most of you know me. I'm Michelle Cross. I'm the Exec Director for Adults and Health. Pass to my right.
Councillor Nosheen Dad, Portfolio Holder for Adult Social Care and Corporate.
Jill Greenfield, Service Director, Communities.
Alexia Gray, Head of Quality Standards and Safeguarding Partnerships for Adults.
Kath Sims, Service Director for Adult Social Care Operations.
And Saf Bhuta, the Service Director for Strategic Commissioning Partnerships, Provider Services in Adult Social Care.
So thank you. We're going to run through a short presentation this afternoon and hopefully highlight some of the outcomes that we received following our final CQC report, which was received in November 2025. So if we'd like to share the presentation, please. Thank you. So next slide. So I just want to do a bit of background and just remind panel members around the Health and Social Care Act 2022 that put CQC assessment of local authorities on a statutory footing. This included social care data framework to improve the quality and availability of data nationally, regionally and locally. And you'll see from the list there what CQC independently review when they are inspecting local authorities, and that is working with people, providing support and ensuring safety leadership. There are new legal powers for the Secretary of State to intervene in local authorities to secure improvement, and that is generally where local authorities have received a rating of inadequacy. Next slide, please. So just to take you through the timeline, and we have been here before just talking panel members through when we did get the original notification that CQC will be inspecting Kirklees, and that came in December 24. We submitted our information return January of 25. The on-site visit took place May 25, and that involved telephone conversation and interviews with providers, focus groups with our staff members, interviews with key individuals within the council, partners and case file audits. Members were also interviewed as part of that on-site inspection as well. Then a lengthy wait, shall we say, where we received our final report November 25, and it was 21st of November, providing formal feedback and recommendations. And it's safe to say, and disappointingly to say, that we did receive a rating of requires improvement with a score of 59, which fell just short of a good rating. And that would have been, we would have been required to get a score of 63. Now, just to sort of say to members that the final report, we did send back a significant challenge when we received our draft report, where we submitted significant amount of, I think it was 160 extra pieces of evidence to CQC. We challenged the factual inaccuracies within the report, which there were copious amounts of inaccuracies in the draft report. When we received the final report, it was pleasing to see that the report did read more positively. However, when you read the report, it was really difficult to understand why we didn't fall within the good rating, because when you read through, the comments are really, really positive. Then you get to one statement, if you've had time to read it, that says there was mixed views or one person told us. So it's disappointing. However, we've kind of brushed ourselves off. We are making sure that we are addressing some of those issues, and I think there were no surprises within that report. There were some areas that we knew we needed to improve on, and we will take you through the comprehensive action plan that we've got this afternoon to address those issues. But also I think it's worthwhile saying that there are some real areas of celebration. We did fare really well in terms of our safeguarding, and Councillor Daddy's going to talk a little bit about that, and the team will talk you through those areas where we did fare really, really well. I think across the country, waiting for assessments is challenging, and I think if they were to turn up now and do an on-site visit, I think we'd have confidence that we would receive a good rating. And Kath will talk you through our waiting well policy and what that is doing in terms of that improvement journey. And let's not forget, we've been on this journey for 2 years, so we haven't stopped. We didn't stop when we did the self-assessment. We continued on that improvement journey, and we've continued throughout 2025 to make sure that the services that we offer to the people that we work with are of good quality, and where there are areas of improvement, we are making sure that we address those into 26 and 27. But you'll hear from officers about what we're going to do in that space. Next slide, please. And this is just a bit of a national overview, really, where just to say that outstanding is exceptional. There aren't many councils that have got an outstanding rating across the country. A majority of councils are clustered around a good rating, with a significant minority requiring improvement. But I think it's fair to say that ratings of inadequate are rare, which is good. But where there are local authorities that are at the low end of inadequate, which is concerning. But I think low inadequacy is reassuring, as it says on the slide, with 1/3 requiring improvement. But I think it does imply persistent national systematic gaps in consistency, capacity, practice standards. SEND always comes up, as does preparing for adulthood, and that interface with equity and early help pathways. But again, the team will talk you through about what we are doing in Kirklees to address those gaps. Next slide. So I'm going to hand over to Councillor Dadd, who would like just to talk you through her perspective. Thank you.
Thank you, Michelle. Good afternoon, everyone. I do want to start off, first of all, by thanking the Directorate for being here today and for their obvious ongoing commitment to the people here in Kirklees. I think I know, and we all recognise that the recent CQC assessment wasn't the outcome that I think we'd all hoped for, but I really want to be upfront. We welcome the feedback, because for me, I really think it's a chance for us to keep getting better, and that's exactly what we're doing. You can see from the slides that have been presented today that there were lots of key strengths identified, and I'm proud to say that our change programme, which Michelle already mentioned, was already up and running even before the inspectors arrived, and we have come a long way with that as well. And again, if they were to turn up today, I think it'd be a different outcome for us. We didn't have to wait for an external nudge. We obviously know our residents deserve the highest standards of care, and we're determined to deliver that. So the wheels were already in motion with our change programme before they arrived. The one thing that the report really highlights is our culture for continuous improvement. Our teams are always looking for ways to do things better, and we're not afraid to try new ideas or listen to what people tell us. We've put co-production at the heart of our work, making sure residents, carers and staff all have a say in shaping our services. Michelle's already mentioned safeguarding, but safeguarding is a real strength for us, and I'm pleased that when the CQC arrived, they recognised that. We have robust systems in place, clear protocols and strong partnerships with health, voluntary and community groups. So keeping people safe here in Kirklees is non-negotiable, and we're always looking for ways to strengthen that work. That said, we're proud of our Kirklees identity. Our communities, as we all know, are diverse, resilient and full of people who really, really care about each other. And that is our greatest strength, and we should be proud about that. I certainly, tried my best, and I'd like to think, Michelle would agree. I work very, very closely with the Director of Adult Social Services and the whole Directorate team, really, not just Michelle. We have regular open conversations and making sure that priorities are at the front and centre, especially in terms of budget discussions and performance against our council plan. We meet on a very regular basis, sometimes 2, maybe 3 times a week. We're not doing this in isolation. We have strong partnerships across the council, regionally and with our communities, but of course there is always more to do. We're absolutely committed to tackling every area of development the CQC has identified, and our change plan, together with additional feedback from the CQC report, has been collated to form an overall draft improvement plan that directors will update on next after my slide. We're investing in our workforce, our systems and our partnerships to make sure that these changes stick and they're not temporary. We're proud of the positive feedback we get from residents and families, and we'll keep putting their experiences at the centre of everything that we do. We're determined to turn feedback into action and show that the difference our improvement work is actually making. Our ambition is very clear, and that is to deliver the highest standards of care and support for every resident who needs us, not now, but also in the future. I am going to hand back over to the directors for them to talk through the improvement plan, but I just want to touch upon something around safeguarding, and I've said this a lot, you've heard it before, but as you all know, I'm new to adult social care, but I'm not as new as I was 6-7 months ago. But one of the very, very first things I learnt was, unlike Ofsted, if, say, you fail your safeguarding, it's an overall fail. The way the CQC works is there are authorities out there who may have failed with their safeguarding aspects and elements of the report, but have still come out overall as good. And that is still really difficult for me to get our head around, because we do fantastic when it comes to safeguarding. We're keeping people safe, which is the most important thing and should be at the front of every service. So like I said, I'm really, really proud of the team. We know we're doing it right by the people, and we can only learn from and take positive sort of feedback from the CQC report. But just want to say thank you to everyone that's been behind the fantastic delivery, in particular around safeguarding, because to me that's really, really important. And I'm still shocked that you can be failing in your safeguarding but come out with an overall good on your CQC, or you can be like us, doing brilliantly with your safeguarding and still be in requires improvement. But we are where we are.
thanks, Councillor Dad, for your passionate response to that. And I agree, and I think, you know, if you want some bedtime reading, it's really interesting just to read a couple of reports across the country and do some comparison. Even those who were in that really high, good, outstanding, still had waiting lists. Some had waiting lists longer than ours, worse than ours. So there is something, I think, fundamentally around sort of the framework and the scoring and what that looks like. And we've had CQC here, haven't we, at a previous scrutiny meeting where some of that wasn't quite clear. So I think going into 26-27, there is some fundamental review of the current framework and what that might look like going forward. That's yet to be kind of understood. So we're not really sure what that will mean for councils once all the reports have been published across the country. It's just a bit of a watching brief, but just to say that we have fed our feedback alongside our ADAS colleagues regionally, but also nationally on the framework and how that's felt for councils, providers, and those who've experienced this current framework. So just to say that we have fed back. Sorry, Councillor Furt.
Thanks, Chair. Given what you described, there's a lot of inconsistency,
Yeah.
local and national. Is there not an appeals procedure?
That's a really good question. I did ask that of the inspectors. I had a call after the draft report was submitted to Kirklees. Wanted a call with the Chief Inspector that did the inspection in Kirklees and asked that question, and no, there isn't. All you can do is do the resubmission of the factual inaccuracies, submit further information. It's done on a very, quite a basic sort of template that gets sent back. They either accept it or they don't, and they'll say, thanks for your extra information, we'll accept that. But generally where it impacts on your score, what local authorities are finding is it doesn't impact on the scoring. I think there's only been a couple of authorities, and Kath will correct me if I'm wrong, where they've done a legal challenge. They've gone into that legal space. But I think there was only 1 or 2 councils that did get their scores changed. And one council, and I can't remember which one it is, actually did get a whole new inspection done because they were so unhappy with the report and the scoring. But you know, considering that it's a year-long, well, actually 18-month-long process, to do that to the team in terms of resource and workload felt really unfair. So we chose not to go down that legal challenge route. And I think there is an aspect of, because ours was published quite late, you learn along the way and you learn around the inconsistencies that there are, so you become less and less bothered about that, and what it does take you into the space of making sure that where there is learning and where you do know yourselves well, that's the space that you go into, and that's the areas of focus that me and my team and Councillor Dad have concentrated on, and that's what we'll do going forward, because unfortunately, because it is so inconsistent and it is quite a flawed system, very little reason for challenge. So I hope that answers your question.
Through you, Chair. Clearly, we're going to have to bite the bullet on this one. But going forward, there's 8 bullet points on here that you've got to address. And you've probably gone some way to addressing some of those now. But what impact will it have on the public at large or locally, and you getting this rating? Will it have an impact?
We're going to go into those areas. The service directors are going to take you through the detail about what we're doing to address those. So should we do that in terms of the 8 areas and then maybe come back if that doesn't answer your question, Councillor Firth, and then we can go into that discussion after. Is that all right? Yeah.
Yeah, if you'd like to continue.
Okay, thank you. Next slide, please. So you'll see from there the key findings for development and actions around our waiting well, transition, that's not a surprise. Preparing for adulthood is an issue not only for us but also for children's, and you'll see from what you hear this afternoon some of the work we want to do together with children's. Access and inclusion, workforce and leadership, market provision, re-ablement, advocacy and our underpinning framework. So I'll hand over to, I think it's Kath, who's going to take you through the first few actions, so she can talk you through those. Kath?
Thanks, Michelle. So if we just go to the next slide. So I think, like you've seen on there, we've got 7 key themes, so 7 key actions that came from the report and our draft improvement plan, and they're all underpinned by a shared framework. So that's our 8th area. Service directors have been allocated to lead on each of those areas. So Saf, Jill and I are going to talk you through the areas that we're leading now. Just to say that, you know, most of our plans, the majority of the things that we're going to take you through now is just building on work that's already started, that's already been going on. And like Councillor Dad said, and Michelle, probably if CQC came next week, they would see already some big changes and improvements in certain areas. Some elements are well developed already, and we're just building on those. Others will be starting with a workshop just to bring different ideas together, people together, partners, including people who use our services to develop these plans further. So I'll take you through the first couple. The first is around how long people need to wait for their assessments, for a review, or if a safeguarding has been raised on their behalf. That's a theme that's in every single CQC report. So if you pick up any of the published reports, they will all mention waiting lists within those. I think it's really important to say that we'll always have waits. Our ambition isn't to get down to 0 waits. No local authority will allocate a case the minute it comes in, because we need to understand a little bit about the request. We need to be able to triage that request, and then we need to be able to prioritise the best team to pick up that request. So waiting list itself is a difficult one sometimes, because you might think the ambition is to get to 0 waits, but there will always be waits, and every local authority will say the same thing. But just to say that we do have a waiting well policy, and we've developed that and been developing that over the last 12 months. That's really well embedded in our community social work teams. There's 2 elements to the policy. So one is that we keep in touch with people. So if people are waiting, we keep in touch with them regularly. We tell them how long they may need to wait for their assessment. We talk to them about any preventative services they could use in the meantime, and we provide them with some good information as well. So that's the first element of the policy. The other is just about how we do that allocation and how we prioritise. So we RAG rate each case that comes through our front door, and we rate them either high, medium or low based on key characteristics, and then we've set our own KPIs for when they'll be allocated. Again, it's important to say there isn't actually a statutory guidance on how quickly a case should be picked up and allocated, but we have our own internal performance indicator that we would want everybody to be allocated within 28 days. That's our ambition. We're not there yet, but that's what we would be aiming for. Other local authorities actually set other timescales for it, but that's our ambition within the 28 days. So the high-rated cases, they'll all be allocated within 5 working days, and they include people who might have an immediate risk to their well-being or their health and safety, or they've had a breakdown of their existing care arrangements. Just to say, our current stats show that we only have 8 people waiting at the high-rated category currently, and we expect they will all be allocated within those 5 days. So, you know, when we talk about waiting lists and we talk about waiting well, those high priority cases, we absolutely make sure that they are prioritised and allocated within those timescales. Medium risk cases, they might be people who they've got eligibility needs, but there's no immediate crisis. They're safe, they're at home, they've got some support arrangements in place. We would want them to be allocated within 15 working days. And then low risk, which might be that actually there's no immediate statutory duties for those people, but they have requested some support from us. We want to allocate within 28 days. So we think we've got a really robust waiting well policy. Like I say, we have rolled that out across our community teams. So they're the teams that work predominantly with people, older people, people with physical disabilities. And we will be now rolling those across our other teams as well, so including learning disability teams and occupational therapy as well. So that's a key part of our improvement plan, that we want to roll that policy out across all of the other teams as well. The other element around waiting is waiting for an annual review. Again, this is something that appears in all of the CQC reports nationally. We know people do have to wait for their annual reviews sometimes, particularly people living in 24-hour care settings, and that's because we've, again, prioritised, and we feel that people who are living in a 24-hour care service you know, they've got support there, they've got people working with them, so their reviews might not be allocated as quickly as we would like. So we have invested in a new accommodation team. That team started in September, so again, unfortunately, it was after CQC had been on site, but one of the priorities of that team is to focus on annual reviews for those people living in 24-hour care settings. We've also worked really hard on developing data dashboards so that our team managers have got access to that information to hand every day. They can see who's waiting, they can see who in their teams might have capacity to pick up cases, and they're using those dashboards to really manage performance and to prioritise that work. So in terms of the waiting well, I think we've made some really good improvements already, and we really want to build on those. We're not starting from scratch. We're in a good place with that. And the waiting well policy was mentioned within the CQC report as well, that we've got a good framework, and now it's about rolling it out across all of the teams. So that's the first action. The second one is around transitions. Again, this is a national theme. Transitions will appear in all of the CQC reports nationally, and that's about ensuring young people have a good and safe transition into adulthood. I think it's important to say, you know, we were aware that this is an area for improvement. This appeared in our self-assessment that we've brought to Scrutiny panel previously. We've talked you through our self-assessment, and we knew that transitions was an area that we wanted to do some work on, and it was part of that self-assessment, and so we have already started with some of that work. And we also know that transitions has been raised through our SEND inspection and Ofsted inspection as well. I think it's an area that all local authorities need to improve on. Just to say regionally, we work quite closely with our West Yorkshire local authority colleagues, and we have come together actually on transitions to say what you're doing as part of transitions for your action plan and what we're doing, so we can share good practice across. So again, that's not just a Kirklees issue. What we have done, though, is launch a joint transformation programme with children's colleagues around transition specifically, and that's going to report into both the adults and the children's senior leadership team meetings and at the Directorate Change Board. So we're going to have that real senior oversight on that transformation plan around transitions. We want to streamline the way people are referred into adult services. I think for certain cohorts of younger people, if they've got a significant care need, we're really good on that. We know about them early and we start working with them early. For some people, we don't hear about them until later, or our pathways aren't quite as we would like. So we're going to build on those pathways to ensure that we've got that good early support planning for young people. The other element around transitions is to have a focused look on specialist provision that's required for young people, particularly people with very complex needs, and Saf's going to talk a little bit later on that was a general theme that came out that we're already on with, but that we want to build on as well. All of that work, like I said at the beginning, is going to involve some workshops with people. We really want to hear the voice of younger people, see what we can do better, see what we can do differently, and help us co-produce our plans. Want to really map out those pathways. And I think it's exciting that we've got that programme approach with children's and adults, with that senior leadership oversight to make sure that we can really improve in that area. So we go on to the next slide, please. This next one was around access and inclusion, and Jill's just going to take you through this area.
Yeah, thanks, Kath. In terms of this was already a really strong area for adult social care, and indeed for the whole of the authority. We're not starting from zero here in terms of the work that has happened around access and inclusion. You know, there has been a lot of work that particularly Kath and the team have done around accessible front door. We do a lot of work around how we navigate access to information and support. So a lot of work, you know, and that's just the tip of the iceberg around the work that is already happening. But it is an area that CQC have asked us to go a bit further on. And, you know, we do recognise that we do have a lot of strong and trusted relationships with communities, but we also know that not everyone is able to access the support and the information that they want when they need it. So what we're focusing our improvement work on is how do we reduce those barriers? How do we understand who we're actually reaching out, who we are engaging with, who we are reaching, and importantly, who we're not? And what are those barriers? Are they digital? Are they cultural? Are they linked to communication? And, you know, as part of that, we're starting to expand that digital inclusion, but also recognising that there is always a role for face-to-face and making sure that we've got that. And that's some of the key pieces of work that we have been doing over the last 12 months, based on some of the integrating the front door, which CAFA's teams have done, but also how we have that in communities with our integrated library hubs, and how we continue to do that with using all our partnership resources, because we do need to have that focus on that early intervention and prevention. And we do know that one size doesn't fit all in terms of how people want to access services. We do know that some of our services have traditionally found it quite hard to engage with some communities. So again, we're reaching out with our partners, and the idea is that we will look at where we have got the relationships and the work, and actually look at where what is it we're missing. Underpinning that is really understanding our communities, really understanding also the you know, the data around that, the data that we have already around who is accessing care, as well as the types of care, and really getting to the bottom of what those barriers may well be. So that's where we are there. We really want to focus on the targeting that prevention and making sure that we can do more earlier and make sure that people get the support at the time in their lives when they need it.
Thanks, Jill. So just come back to me on the workforce and leadership. And this is a broad area, and we've brought it together really under one theme. But this is around generally our workforce and our management and leadership within that. CQC did identify some issues around inconsistencies with supervision across our teams, which we want to get on top of straight away. They also mentioned about how visible some of our management teams are. And they raised actually the diversity of the senior leadership team as well. Diversity and inclusion that Jill's just talked about. They did ask about our senior leadership team in that respect. There was also some areas of development identified for practice. So we've brought those together into one theme, which we've called workforce and leadership. We do obviously want empowered and skilled teams. We want leaders who can really drive that continuous improvement, and that's what this theme is all about. We've got a well-established board that we call our Consistent and Confident Practice Board. So that's where our principal social worker leads and talks through her improvement plan around practice and that social work practice. That's already in place. It's been going a year now and is working really well. We've worked really hard on refreshing our approach to case file audits. So that's where we might pick a random sample of cases and we'll audit those, see that the practice is being good within that, the people have received the outcomes that they want, and we will get in touch with the person and say, did you get everything that you wanted from your assessment, and did we support you in the right way? And that really drives our best practice and our approach to best practice as well, and we want to build on that in the year ahead, particularly team-to-team challenge. So teams will case file audit one another's cases and feedback on that practice, which is, I think, a really positive way to do things. We've introduced best practice tools, we've introduced spotlight development sessions, etc. We've also, as I've previously mentioned, we've developed our performance dashboards, and I think that's really important when we're thinking about practice. So our team managers can use that to assess performance of their teams and can set themselves challenges for that continuous improvement. And those dashboards have been rolled out across all of our teams. The final part of this is about our recruitment strategy. We actually do really well in Kirklees in terms of turnover in our social work teams. It's not very high. We don't have many vacancies in our social work and occupational therapy teams, but there are some hotspots sometimes. So, it's really important that we have that inclusive recruitment strategy and we think about those career pathways. I think one of the things that was identified as a good area in Kirklees, like Councillor Dadd mentioned, was just around that innovation and how we develop our staff, and we really want to build on that. And in terms of the diversity of our leadership team, we have, as a directorate, signed up to the social care workforce race equality standard. So that involves looking at the data, looking at the makeup of our teams across Kirklees, as well as our senior management team as well. So we'll be continuing that work. And then as final part of this, we want to bring some staff together in a workshop just to ask them what they really want to see from their senior managers. We often get told, you know, our managers as visible as we would like, and I think Michelle, Councillor Dad, myself, Saf, Jill, we all get out to the teams, we all see the teams regularly. Is there anything else they want differently than that, and teams meetings and newsletters, etc. So we want to put that in the hands of the teams to say, what more do you want from us? And they can help us co-produce an action towards that. So that's that on workforce and leadership, and I'll now pass on to Saf for his areas.
Thank you, Kath. Can we move on to the next slide? Thank you. So I want to start with market provision, because this is where pressure in the system is often quite visible and where improvement has a significant opportunity. CQC were really clear with us that parts of the market, particularly around younger adults with complex needs and respite, are under strain, and that's not unique to Kirklees, but it is our responsibility to respond in a way that is deliberate rather than reactive. So what is changing here is our role, and fundamentally what we're doing is moving from responding to market failure and moving towards active market stewardship, active market shaping, and that's going to be done over time. And what that will mean is that there are clearer commissioning signals, closer engagement with providers, and we're really using the Kirklees Care Association or the Kirklees and Calderdale Care Association to support us on this journey. And then also aligning quality, capacity and affordability. So rather than treating these as individual and isolated conversations, really thinking about the impact on the market. The test for effectiveness in this area will be where the market becomes more resilient, more predictable and responsive. And so that will mean people will experience fewer delays, fewer placement breakdowns and improved choice. Moving on to reablement, that's always been central and a key cornerstone of our action plan and our ethos in adult social care. It's central to our approach to supporting the NHS, thinking about flow, thinking about demand, and fundamentally maximising the independence of people who go through a reablement journey. Now, CQC did recognise our intent around strength-based approaches and practice, but the opportunity now is to ensure that reablement remains inclusive and also is consistently experienced as a time-limited and outcome-focused intervention, not a gateway into long-term care or long-term packages of support. We know that where reablement works well, people do regain their confidence, carers feel supported, pressure reduces elsewhere in the system, and where it's inconsistent, that pressure starts to show up in waiting lists, in longer-term packages, and in market pressure and market demand. So our focus isn't just on the reablement service itself, it's really thinking about how well the system or the wider system is aligned around it. So thinking about hospital discharge, community health, longer term support. So the action plan does include some technical aspects of what we will be doing, but fundamentally success here is determined by reduced dependency, more clearer pathways, and more people leaving reablement with their independence maintained and maximised. On to the next slide, which starts off with advocacy. Now, advocacy is an area where CQC quite rightly challenged us. It's important that we frame this in the right way. We're really clear as a service and a leadership team that advocacy isn't an optional service. It's a really important safeguard that underpins people's rights, their voice and their confidence in decision making. I think previously, historically, advocacy could have been seen as quite variable, potentially quite reactive. So what's changing through our action plan is that we want to embed advocacy earlier in our pathways, particularly at points where there are complexities, thinking about transitions and where there might be disputes or disagreements. So trying to do that at an earlier stage rather than relying on late referrals. In this area, improvements will be seen where people feel heard and they feel heard at the right time, not just when issues have arisen and reached a crisis point. I'm going to hand over to Jill to take us through the final point on the action plan.
Excuse me. So in terms of this, I think what we really wanted to do, and that we've tried to do all along, is have something that really anchors all of the work that we do, both in practice and in the work that we do tackling inequalities, that will help us strengthen that. So we are looking at that framework that allows whatever other improvement activity takes place, we're able to hook that into something that really centres on tackling inequalities, improving practice, improving access, and all the things that people actually tell us they want from a service at the time that they need adult social care. We're going to do some more focus on the Inclusive Communities framework. That has been socialised through adult social care. There is some work that we have done already. It's about actually revisiting that, looking at the principles and the way that we work to make sure that whichever bit that you look at of the service and the improvement activity, that is a consistent theme, that we're applying those 3 pillars around belief and care and belonging, and actually the way that we approach that work is consistent. And we really do think that that is going to give us a real opportunity to get to, as we were talking about earlier, some of that targeted prevention, and really make sure that we understand our communities, we're working alongside them, and we understand that individuals are part of communities, part of families and part of communities, and we see the whole picture. And that really is the work that we'll do through that, and hopefully, we are confident that that will be the thing that will make everything recognisable, not just to people receiving support and care, but also staff and understanding what it is that we're trying to do in our improvement work. Thank you.
Thanks, team. And I think the final slide, if you want to move on to the final slide, which we're going to talk you through the governance, I think we're going to invite Alexia. I think most of you know Alexia. Alexia's been the one who has driven CQC. She's been the consistent person who was there right from the beginning and supported us in our self-assessment. So Lex will be the person who supports us going forward in terms of our governance and how we need to report, but how we need to continue on this improvement journey. So Lex, hand over to you.
Thanks, Michelle. Just wanted to provide a bit of a reassurance around what governance arrangements we've got in place. And I think Michelle mentioned earlier on that we're not yet clear what CQC's intention is for future inspections, and we don't, or even if they'll continue to use the same framework. So we have fed that back through the auction number, our feedback both on the process and the framework. What we do know is that any council that received an inadequate rating, whether that's overall or just in one of the domains, will be required to report directly to CQC or be subject to Secretary of State intervention. Where people have got requires improvement, which is obviously Kirklees, the CQC has sort of delegated the governance around that to Partners in Care and Health. So Michelle met with our Care and Health Improvement Advisor to have an initial chat about the report in general, but then we also provided some feedback and similar to what you've had today in terms of the main improvement areas that we had already been focusing on or that we needed to focus on. So that's already been submitted, and we expect that we'll get asked for more reports, probably on a quarterly basis, just so that they can keep an eye on how the improvement journey is going. The main improvements will be overseen by a refreshed CQC board. We've had a board in place from the very beginning, but what we want to do is widen that to include other corporate enablers, partners, and that will be chaired by Michelle. And then that will also pick up the independencies between other wider boards, including the Consistent and Confident Practice Board that Kath mentioned, and the Contracting and Commissioning Board that SAF chairs. And with the transitions one, with that being a sort of joint piece of work between adults and children, that will report directly through the Directorate Change Board, because it is a huge programme of work. And then we also will be providing quarterly updates to the Executive Leadership Team and 6 monthly to the Executive Board on progression of the improvement plan. So all that's already in place. So hopefully we'll be able to demonstrate the progress on that improvement plan, at different points during the year. So thank you.
Thanks, Alexia. And I think that's the end of our presentation, so just open it to panel members and chair for questions.
Yes, thank you, Michelle, for the quite an in-depth presentation by you and your team. I found it useful, and of course by Councillor that was not part of your team as such. But thank you to all of you. I will have a few points to raise, but I'll wait and see. Colleagues, have we any questions, any comments? Councillor Munro.
Thank you, Chair. So I've just got a few questions. My first question concerns future consultations or your future consultation strategy, which picked up on in the overall summary on the CQC report. Going forward, due to the comments that were made about a lack of uniformity in the way you consulted, have you now got a new strategy in place for how consultations in the future will be undertaken? That's my first question. In relation to transition for younger adults, there is a referral to new accommodation projects are underway, and for accommodation for 18 to 25-year-olds. I just wondered when that's likely to be finished, and will that accommodation be will it be able to accommodate all those people in that age group? And then I have a further question which came under supporting people to live healthier lives, and that is where partners, just quote from the report, some partners told us people found the local authority website difficult to navigate and communication about available services, including equipment, could be clearer. Well, having had some personal experience in this through someone I know, I've got the impression that people feel that they're only given the information they need on a need-to-know basis only, and that there's not enough information. They feel lost and they feel unsupported because they don't know what they're entitled to, or they don't know what they should be having in place in the home. And it's only if somebody perhaps visits them and there's been a deterioration in the person who's ill or the person who they're caring for that it actually comes to light that there's a lot more available to them, but they don't know that until you know there's somebody actually visits them and there's been a significant change in that person's illness. So, I mean, why isn't that communication being freely conveyed to people so they don't feel lost, they don't feel unsupported, and they feel like they know what is available for them? Is that being addressed? Thank you. Those are my questions.
Okay. Quite a lot there. No, it's fine. It's fine, Councillor Munro. And I think in terms of your first question around consultation, I mean, that will be the golden thread that feeds through all the improvement plan. We want to reach out to all our communities, our staff, our partners, to make sure that it is an inclusive plan, that it's not just a council plan. I mean, it could sit just in the council because there's no statutory duty to share it. Like SEND, it has to be signed off by both partners and it has to be signed off by ICB colleagues. This doesn't. However, we really want to make sure that it's inclusive of everybody that we work with. So absolutely where we are consulting, and I think the team did touch on those areas where we really want to go back out and make sure that people understand what adult social care does. We did some really good work, and it was highlighted in the report around the Pakistani Association, making sure that they understand what adult social care is, what it does, because until you actually need it, it's one of those things that's almost hidden from people, which is unfortunate. And I think we do some really good stuff, we do some absolute excellent work, but we don't often shout about it. So absolutely, we want to make sure that we are out there making sure that people understand what they can access. In terms of accessibility, absolutely. I mean, I think when CQC came, we were right in the middle of changing our front door offer, and I'll refer to Kath and Jill, who led that piece of work, which was unfortunate. Timing is everything with these things, isn't it? I think the offer now, and I think the accessibility is much improved. I think people would probably have a different view now, I would hope. But again, I mean, I don't know whether Kath, Jill, whether you want to come in on that change point.
I think it's probably a bit of both of us in terms of before you make that contact and after you make that contact. And absolutely, we recognise that point around how do you find out that information. And it is also quite complex as well. So some of the work that we have been doing is, as I said, around our integrated front door. We're working so the integrated front door and the integrated library hubs. We're just starting, we've been doing some planning and working with CAF's teams about if we have got a certain cohort of people coming here in that we think that this, from our working libraries, that we think that it would be useful. We are working with the social care hubs to make sure that maybe they're there on a day that we're talking about that we might promote something like a specific clinic, whether that's around carers. I mean, I say clinic in the broadest sense, or whether that's, you know, blue badges, something that is obviously one that causes, you know, a lot of people, a lot of, you know, hardship in trying to navigate that system. But what we're interested in is what else? What are the other questions we should be asking at that point? And how can working alongside more formal adult social care debunk some of those myths, make sure that if assessments need to be done, they can be done, or they can be signposted directly and, you know, with that passport of professionals into other services. Co-production is a big part of that as well. We've got a strong theme around co-production, and it's about how do we take that further? How do we take that further away from what has been, you know, a traditional co-production board? How do we embed those principles in all the work, from assessments to contacts to care plans? How do we do that? And I think, you know, we have quite a lot in place around that, but it is something, you know, a perennial problem for all websites. They never really tell you what you need to know, but how do people access things in the way that they can? We all know people who can navigate websites and make sense of that, and we all know people who can't. So what we're trying to do is make sure we've got enough face-to-face support in our communities, or at least somebody who can signpost people to somebody who is going to help them. Because that's the other thing, is if you can go from person to person, and that was a big piece of the work that the part around the front door of simplifying those pathways and processes that CAF's team have done. So yes, I can't say that it's absolutely perfect, but it's certainly coming together much more. And I don't know if you want to add anything into that, CAF.
No, not really. I think, yeah, absolutely acknowledge that the website could be improved, and I think that's, as Jill said, and you know, that's feedback that we need to take on board, and that's one thing that, you know, it's a very distinct piece of work that we can say, right, let's review this and let's get on with that. I think it's about how people have that initial contact with us, and it's really important that it's not always online. And I think, you know, you've read the report, you see that there's something there about digital exclusion and digital inclusion, but digital isn't the only way that people can contact us. So it's important to say that we've got, you know, face-to-face through libraries, you've got phone contact through the contact centre. So it's about wherever you access the service, you should be able to get the same level of information, and that's the ambition that we've got. I think working really well with our Kirklees Direct colleagues to make sure that if people do phone up, they're getting the right information, they can be signposted, they can be sent information out if they want to be as well. So we have to ask people, you know, how do you want to receive your information? Because not everybody wants to receive it in the same way. So our more detailed action plan around access inclusion really has some more detail there about what we're doing specifically around that topic.
Thanks both. And then to answer some of your questions around preparing for adulthood, interestingly, we had a peer review that was undertaken with Wakefield colleagues over the last couple of days, and I think their findings were really interesting. I think certainly from the feedback yesterday, there were no surprises in that. They told us again that we needed to start planning early, and we need to start planning with education age at 14, start having those conversations right through the educational system. They called it preparing for independence, which I really like, because I don't think preparing for adulthood actually does it for everybody. So I think there is a terminology sort of shift in there in terms of that culture. You asked when the work would be starting. It's starting now, so the scope for that work has been scoped now. And as Kath said, It will report into my board, but also into Tom, who's the DCS board, and then it'll go all the way up to DCB, which is the ELT, so the chief exec and the execs will see the progress on that. That will be a 12-month programme. The difficulty with preparing for independence adulthood is it never finishes because, not unfortunately, those young people are in the system now. We know them, education know them, and I think the biggest thing for me, and I did feedback to the team last night, is we should be tracking those individuals now because we know them. They're in the educational system. We shouldn't have surprises at 17 and 88 months, which sometimes we do. Unfortunately, sometimes our education system does keep young people in education when they don't need to do. Some young people could go to college at 16, but because the education system is up to 19, some young people stay till they're 19, so they're not always known to us until that very late stage. So I think if we can start to plan much earlier together, and that our systems communicate with one another, then that will be a better outcome for those families and those individuals who sometimes don't experience the best transition into adulthood because it's too late. By the time they get to adulthood, all that planning actually should be known, and our commissioning intentions, we should be able to be saying 5 years ahead, what does that look like in terms of that complex accommodation or that complex supported living provision, what does that look like? So when Saf and his team are thinking long-term commissioning planning, what does that look like for those young people that we know are going to arrive in adults in that time? Because not only does that prepare those individuals and those families for independence, it means that parents don't experience what they describe, and it's always described as that cliff edge, because it is different legislation, it is different statutory duties, and if we start to have those very early conversations with families, it prepares them as well, because it's scary. You know, a lot of parents who are got young people who are very, very complex don't actually know what's out there and don't know what those opportunities are because it's not presented to them at a stage in their young person's journey at the right time. So I think this is a very exciting piece of joint work that will have rigour and grip at a very senior level, and I think quite and it's not about saving, isn't this? But it will save money, because we do know that a lot of children are sent out of area to very, very expensive placements that actually don't deliver great outcomes for them and their family, and that's purely because we don't have the specialist provision locally. The new special schools will be, there's a lot of investment going into special schools, which will be fantastic provision for Kirklees, outstanding provision actually, to have 2 new special schools being built at a similar time, so that our very, very complex young people don't have to go out of area is only a good news story. So it will be a journey that we'll go on this year, but it'll be a continuous journey that hopefully Kirklees continues to have grip on. I think the adaptation...
One moment.
Oh, sorry.
I'm trying not to interrupt you. But
No, it's fine.
I'm afraid I'm going to have to call a short break for personal reasons. So can we have a 5-minute break, please?
Okay, no problem.
Midstream. She has a really
Excuse me. Yes, welcome back. Thank you. Michelle, I interrupted you. Have you anything else to add?
Yes, it's just to answer the third question that Councillor Monroe posed to us, which was around our specialist accommodation, and I'll invite staff to respond.
Thanks, Michelle. Councillor, you're right to probe into that. It's one of the most complex pressure points in the system. And I think what we found is that it's not an issue about lack of buildings. I think it's more around the alignment between housing, social care, and then thinking about the kind of quality of provision that we want and working with the market in that respect. And one of the things we have done, particularly with younger adults, because their needs can be quite bespoke, and what we're seeing now is a profile of younger adults that was very different to some of our assumptions that we had made previously in our commissioning intentions. Previously, we might have thought that younger adults have got profound learning disabilities, whereas now we're seeing younger adults with a load of very complex intersects around forensic, mental health needs, etc. And so their needs are quite bespoke. The needs shift over time, and our approach has got to be grounded in progression and independence. So through a lot of the work we're doing with the specialist accommodation board, so colleagues like Joanne Bartholomew, myself, we sit on that. Colleagues who are here today also sit on that board. We're starting to talk more about what's a demand intelligence, what's a profile of need, how do we align that better with our resources around accommodation, and then conversations with the market. We were talking outside before we came in that we're already starting to see some results with some of our most what previously have been hard to place cohort of younger adults. We're starting to see results, and I think that's a result of using procurement to test the market, seeking feedback from providers, but making those very clear signals, as Michelle had said, that this is what we're looking to seek, this is the kind of quality we want, and this is how it needs to be grounded in independence. So we're not making lifetime commitments, we're thinking about what people need as they progress through their adulthood. Yeah.
Thanks, Saf. Does that answer your question? Yes. Thank you.
Colleagues, I think you were first, Helen.
Thank you. Just a couple of questions, please. One was on the leadership diversity. Could you just expand a little bit on what that plan is? And the other one was around hospital discharge effectiveness. I saw it was mentioned, but I didn't feel I understood what CQC was saying and then what response was. Just a little bit more detail, please. And in terms of access to services, when we're talking about it might just have been as it was written on the slide, but the concern that CQC seemed to have was that there's a reliance on digital access. That the response seemed to say we'll expand digital access, but keep the same level of face-to-face. So that's why I'm asking the question, because I didn't necessarily get the sort of, and is that something that's asked at assessment? What is somebody's capacity to digitally access services? Thanks.
Yeah, good questions. Thanks, Helen. So leadership and diversity, is that you?
Yep, I can take that one. So we have, as a directorate and with our children's colleagues as well, signed up to something called the Social Care Rate Equality Standards, Workforce Rate Equality Standards, known as Social Care RES. So that was discussed as part of the CQC inspection. Actually, they talked to our principal social worker about diversity, and she mentioned that we had signed up to that. And what they questioned was, well, have you got diverse workforce across all the range of different levels within our workforce? And there was a challenge that have we got equal diversity in our senior leadership team? So we have signed up to that as a national programme. The first part of that programme is to look at the data and look at what our workforce does look like, so then we can start to build some plans from there. We've brought it together. Michelle's going to chair a board that is looking specifically at our rate equality standards, and that is kicking off actually this Friday. We've got a workshop with some key partners on Friday to start looking at that. So it's some work that's just started. I think it was one of those things that kind of came up in the inspection. We might not have particularly expected it to come up, but it came up as part of a conversation about other things, and then that appeared in the report. So we want to pick that up and run with that. It's important to us. We need to make sure that our workforce reflects our communities, and that includes, you know, frontline workers right up to our senior managers as well. So that is one of our priorities moving forward.
Could you just expand on that? What might that look like? And I know you don't know yet because we're just at the beginning, but that other authorities have done in terms of how you address that in terms of leadership.
Yeah, I think there's work you can do in terms of inclusive recruitment, even very simple things like where we advertise for posts. I think there is, this work was done in the NHS a few years ago about people reaching ceiling and often can't get into senior management posts. There are training courses there. There are workshops available nationally as well that we can join up with. So we need to do the planning first, and then we'll have an action plan from there. But I know that Skills for Care run a course. It actually came to my learning and organisational development group last week. It's like a 3-day course for leaders who, from particular backgrounds and protected characteristics, who might want to move into senior management roles and feel excluded. So we've signed up to some placements there, and we're going to offer that out to our workforce. So there's some really good, exciting things that we can do on that. But I feel like we're just starting that work really now. But we'd be happy to come back, certainly if once we're a bit further down the line with it.
Well, just a moment. Is that you're satisfied?
On that question, but I think.
Do you want to give way to Councillor Zaman?
Yes.
Councillor Zaman.
That's what I meant to say. Well, thank you.
Well, just on so the question that my colleagues just asked, and you've given quite a comprehensive answer, but I was wanting to know, how is it going to be monitored?
I'll take it, Kath. I think, like Kath said, there'll be a board that specifically is chaired by myself, so that we can have update progression reports that go through that board. It's really difficult. It's one that I don't think any authority has actually managed to crack over the years, really. And I think sometimes we recruit to skill rather than diversity. And I think as an organisation, we need to think slightly differently about the people that we need in those roles, and what life experience those individuals come, rather than ticking a qualification box. And I think, like Kath said, are we serving the community in terms of its diversity? And that's not always around your culture and your religion. It's about making sure that we've got the right resources in the right places, having the right conversations. So it's much broader than that diversity. And I think leadership, within its purest sense, making sure that leaders understand that, and that they understand the communities that they are serving. So it's multifaceted, really, and I think it's quite complex. And I think the fact that there is a national framework now really gives us a great lever in terms of us understanding our workforce. Does that help? Yeah. Thank you.
Thank you.
And I think you talked about hospital discharge, Helen. Do you want to know a bit more about what that journey looks like? I'll invite Kath, and are you taking that stuff?
Thank you.
To you.
Thanks, Michelle. Helen, thanks for the question. Of course, with your experience and your history, and I know it's an area that you've always championed previously when you were in the council as well, and you'll appreciate that it's a whole system issue. It's not something that adult social care in isolation can tackle. So a lot of this is about the strengths that we have in our partnerships, and CQC did reflect on that in their report in relation to our strength in depth in partnerships with our key partners. And that's a really good foundation that we start from. Where the pressure often is and remains, it's typically where demand surges, like winter pressures, for example, where complexity and where capacity in either in-house services or the market, where they start to cross-cut. I want to just reaffirm that many people are discharged well, and we have improved significantly in Kirklees in relation to our discharge offer as a system. And I've been here, I know Kath has been here to the panel before, as has Michelle, to talk about reablement, intermediate care. We see more and more people navigating through those pathways with really good outcomes and positive outcomes as they complete their journey on reablement or intermediate care. The challenge is around consistency of that offer and ensuring that that remains consistent throughout the year, but also consistent in relation to people from different backgrounds, different groups, and their understanding of what the offer is.
Does that help, Helen? There's a third, Eric. She had a third question. Yeah.
Yes, I was going to ask if you'd finished.
Access and face-to-face.
I'll get there, Michelle.
Yeah, and then... Oh, sorry.
That's it.
And I think Jill sort of alluded to that. It isn't one size fits all, and it's not that we're trying to do more digital. I think where people want to access digital services, then obviously there will be platforms for people to do that. And let's not forget, quite often people come into social care using a digital platform around that financial assessment. And I think where possible, we want to keep people on that journey, if that makes sense for them. And I think what Jill was alluding to is we've now got library hubs, where if people want that face-to-face intervention, they want that face-to-face conversation, that is available for people. Because what you can't do is push everybody into that digital space, because it doesn't work for everybody, and it doesn't work for every conversation. So I think what we're trying to say is it will be a mixture across Kirklees, and wherever you access services or whether you where you find that comfortable, there will be a mix of digital access to IT, but also there will be people who are on hand who can answer your questions face to face. And I think what we want to do in terms of our social workforce is where people, for example, we might have surgeries in the library hubs, so you've got an instant access to a social worker, because people, I think COVID didn't do us any favours in that. Everybody went to work at home, and I think people found that quite difficult, that there wasn't that person even on the end of the phone for them to access. So it's kind of that moving feast in terms of making sure that we serve what people need and not pushing everybody down that digital space, because it doesn't work for everybody.
I completely agree, and I think when people get to the point of accessing, it's also referring to something you raised earlier about people don't know about the service until they need it.
Absolutely.
And usually when people need it, it's at a point where they're perhaps vulnerable, in crisis, and not necessarily in the greatest place to navigate it. So the easier it is, obviously, the better it is for somebody to get the service that they need direct.
Yeah, and I think there is another element which we're looking into, is equipping our social workers with digital devices so that they can capture that voice instantly, because I think that's been problematic, hasn't it, Kath, where we don't have that facility yet, but we are looking towards making sure that the digital space where our workforce working is much easier for them too, and that we modernise the workforce in making sure that because technology is moving at a pace of knots, isn't it? And I think we need to make sure that we keep up with that pace, and that we equip the workforce with the equipment that they need to do their jobs really, really well in communities. Is that helpful? Thanks, Helen.
You've had your point there, have you, Habiba? I'm sorry I missed that. Well, don't go on now then, please. Don't hit your mic.
Thank you. My questions are based on the EAR action plan, sort of around the waiting well. So the report references dashboards, weekly huddles, KPIs, but doesn't detail how data inequalities, waiting times or outcomes are disaggregated. There's also no clear mechanism described for public reporting or progress on the improvement plan. Are you able to tell me how real-time or transparent is the data that you've presented us?
I mean, Kath can come in on sort of the waiting well and things like that. I mean, I think the transparency, I think we are pretty transparent as an adult social care service. I think the teams have daily access to data that shows them real time where people are on that journey. In terms of that public facing expectation around the action plan, this is the start of that. I mean, this is, you know, this is a public meeting. I think if there are people who want access to the action plan, I've written out to all partners, I've written out to everybody who was involved in the inspection. I mean, the report's available online. There isn't a statutory duty to publish the action plan. Like I said earlier, that's not a statutory duty, but certainly we will be working with our communities in this space of improvement. And I think Jill alluded to the fact that we want to co-produce as much of this as possible, that we make sure that people are involved and come on this journey with us. And that does include people who are affected by service change, that are affected by the services that we provide, but also our partners. Because this touches everybody. This isn't just adult social care. So absolutely, I think we are very, very transparent in how we communicate out to our residents. So we certainly have not hidden the fact that there are areas of improvement. I mean, it would have been quite easily, you know, to come and say, you know, we're great and aren't we wonderful? We know we're not. And I think adult social care is challenged. And I think it's, you know, the resources and things that we have to deliver are really, really tough. However, we do deliver good outcomes. We've got some fantastic feedback, even through the inspection report. We have seen some really good feedback from people that were interviewed that did say quite openly that they do value the support that they do get from the team. So absolutely, I do think we are transparent.
Thank you. Just to follow up. So engagement is described really well in your report. But the report doesn't sort of identify how feedback from underrepresented or marginalised groups shapes the policy or shapes the sort of service design. So can I ask how feedback from service users, carers or marginalised groups, communities feed directly into improving the plan? Is there any mechanisms available to them?
Yeah, and I think Jill touched on that, but I'll get Jill just to kind of go over what the intentions are, if that's okay.
Okay, so there is existing practice around that in terms of the feedback loop, but it is an area of improvement that we do want to focus on. So part of that, I think, you know, we're trying to reduce barriers. To reduce barriers, we need to understand, which is what you're saying, who are we working with, who are we not working with, and how are they experiencing services. So similar to some of the work that we've already started, such as the integrated front door, is really understanding what's a person's journey through a service, how do they access and at what point, and what do they come across, and how is that different for different groups. So going back to the inclusive community framework, it is about knowing communities, and part of that is making sure that our staff understand the data and how to use it. So we're going to do some workshops around that. It's not that they don't understand it, but it's about how can we push that further in terms of understanding communities that they're working alongside a little bit further. You know, adult social care staff are, you know, face a lot of demand, have a lot of responsibilities, and it's how can we do this so that it's embedded in the way that they work. So we have got some work to do on that. We have got some workshops that we are going to run out around that, so that we can really look at what are those protected characteristics, what are those barriers, how do we look at different viewpoints of that, so we can have the data, the more hard data that we have, but also what's the insight we're getting from other services, what's the insight we're getting from people and communities. You know, we've done in other areas work with our community champions really successfully, particularly around raising awareness with domestic abuse, for instance, to name a few. And it's about how can we bring some of those mechanisms in a right and proper way into how we improve that access into adult social care, and make sure that we are really reaching to the right people to make sure that we get that right. It isn't that it's almost like we've got a lot of the right parts, but we've got to bring it together in a different way to make more sense for our staff and for our communities and those individuals who need care, which, you know, you've all touched upon, is often at a time of crisis, people feeling very vulnerable, and also, you know, nobody's going to really want to know about that until you do need it. and it's making sure that we can get that at the right time. So there's pieces of work that we're going to do around understanding our data, understanding our communities, looking at the approaches and making sure that we can capture that, but also, really importantly, I know I've repeated this, but make sure that we look at other insight and what people are telling us, making sure who aren't we listening to, who aren't we seeing here, and make sure that we capture that. So I think that whole programme of work is yet to come through, but what we will do is run quarterly data sprints, for instance, to understand, okay, is it making a difference? Are we seeing any change in practice? Are we seeing anything different happening? But then also wrapping around staff as well with the support that they need from the other programmes that have been mentioned and other interventions. And it is making sure that each intervention we do is seen in that way and takes that approach that we set out in the inclusive community framework as amongst other professional standards that social workers have as well. You know, we mustn't forget those. Those are, you know, really rooted in addressing inequalities at its, you know, absolute heart. So I don't know whether that completely answers your question, but we are at the start of it. But we are going to bring more data, and again, that will be run through into the CQC board. I couldn't remember the name of that, sorry.
Thanks, Jill. Does that answer your question? And I think just to finish on that, and I think there is a part to play for members in some of this. I mean, obviously we work really closely with Councillor Dadd, but where there are things that members are hearing in their own wards, it's making sure that if it's an adult social care issue, that is brought to adult social care, because quite often that can get lost in translation. It doesn't go to the right department, doesn't go to the right person. So I do think there is a ward member issue here as well, because I do think there are, I mean, in your communities, you know your communities well. And I think if there are gaps that you are seeing, then please make sure that that's fed back through the right routes, because that's your job. So yeah, thank you.
Thank you. Councillor Purr.
Thank you, Chair, and thank you for your presentation. But there's this one little aspect of adult social care that you've not touched on today, and that's end-of-life care. I know you work with many partners, GPs, hospitals, you mentioned discharges, and lots of families. But how does it play a great part in the services, your services, place in the world? And how does somebody contact you if they want help for end-of-life care for a relative and they're desperate?
I mean, there's a variety. I mean, there is an end-of-life partnership that's led through the Kirkwood. They're the leaders of that, and you know, they're very well established in terms of supporting families through that pathway. I mean, people come through different routes for end-of-life support. That could be through hospital discharge, it could be through community. It varies significantly, and I think, again, through our front door, there's lots and lots of areas where people could get that support. But generally, if you are end-of-life, and correct me if I'm right, team, you would be known to social care. People are fast-tracked. People are fast-tracked through our intermediate care provision. They're fast-tracked through hospital discharge. We work really closely with ICB colleagues. So there should be nobody who is without support at that end-of-life stage, because there's lots and lots of support in Kirklees that surrounds that. And I think a few months ago there was significant anxiety around the Kirkwood losing provision. That provision has not been lost, and in actual fact they're back up to full capacity in terms of their bed base. But they also do community outreach through the Kirkwood. They've got social workers that do low-level Care Act assessments. So I think that is generally a well-trodden pathway, and I'd be surprised if people don't access that. CQC didn't actually ask the questions around end of life. It wasn't something that they addressed. No, they didn't, and I think it's really difficult, isn't it, because they were on site for 2.5 days. It wasn't something that was a real feature in the self-assessment either. But you're right, that whole life journey for somebody who's in receipt of support, care, end of life, actually maybe should have probably should have been addressed and should have been discussed, but it wasn't. But that, from a Kirklees perspective, that is actually a pathway for somebody. There's lots of support through Macmillan nurses, Admiral nurses and all those sorts of things. So I think Kirklees as an offer, whilst it was fragile, is building itself back up in terms of what it delivers for people at end of life stage.
Can I ask if we, as a local authority, provide help, assistance financially? Do we provide equipment? Or does that have to come through the GP or the hospital?
It's based on an individual sort of end-of-life pathway, and I think if it's equipment at home, it would very much depend on what that individual needs. That could be provided through our crisis service. So if it's a specific profiling bed, absolutely we would be able to provide that for that individual. If you're talking much more in-depth things around medication, syringe driving, that's done through contracts with NHS. That's not done through That's not done through social care. Generally, when you are at an end of life, it is a health-driven pathway for that individual, because obviously people are dying, and generally it does involve quite complex medication, depending on what people are at end of life, experiencing for end of life.
It's not really like a conversation, but it's a jigsaw, isn't it?
Yeah.
With those facilities and with all the partners you work with, and so in a jigsaw, some people do fall through those slots, if you like, for want of a better expression. And I'm sure experience of it.
Could I just ask one quick question? Can you just confirm then that if somebody goes into hospital, this is not a CQC question, this is just an advice question really. So if somebody goes into hospital or is diagnosed as being needing palliative care, would it be up to the hospital then? It's the hospital's responsibility to initiate that pathway?
Yeah.
Thank you.
Yeah, it's not social care responsibility at that stage. Absolutely not, no. But the way that people access services through that pathway would be multifaceted. And you're right, Eric, it can be a bit of a jigsaw, and it would be unfortunate if people do fall through that, but I would hope that people don't, and it's not high numbers of that, because like I say, it is quite a well-trodden pathway. So thank you.
One further question on that, please.
I'm just going to ask if any more questions. Councillor Munro.
Sorry, Chair. I just want to know, so when you say the NHS control the contracts for the health care for people on an end-of-life pathway, is that controlled by the GPs, by the local GPs?
No, it's commissioned through ICB.
All right, okay. All right, thank you. Thanks.
But the GP will contribute to that plan, depending on what that individual needs in terms of medication and all those sorts of things. So yeah, but it's not. It's a contract that's ICB led.
Anything else, colleagues? Well, I do have some comments, I suppose, but I've got worries about the interface between NHS and social care, and I know it's been touched on, but it does sometimes seem that they don't just quite play nicely together. I have seen some problems with that. Would you or one of your team like to comment on that?
I suppose it depends on what you mean, Councillor Armour. I think in Kirklees specifically, my experience of our partnership with our ICB colleagues is really, really strong. We have joint leadership meetings, we have joint boards, we've integrated pathways, and like Saf and Kath have both said, we've got teams who work really closely together within our acute settings. So our social workers are in our hospitals, for example. Social workers will be on wards with doctors, with clinicians, with consultants. In terms of that partnership, I think it's really, really strong. So playing nice, I think we do. I think there probably are areas where we could do better. If you're asking me to comment on what might happen through the changes, it's quite difficult to comment on that because it's still a bit of an unknown. and you'll know the national picture is that 50% of the funding is going, but it's an emerging picture. We don't really know what the impact on that is going to be yet. I think there is a session with ICB colleagues coming up, and hopefully some of that intelligence will be able to be shared with panel members. But I think as a scrutiny panel, it's something that we all should be concerned about, because as a system, losing 50% of the workforce is going to be significant. And I think we do need to think carefully about where that work will go or won't go.
Right, thank you. Perhaps interact smoothly would have been better than play nicely, but there you go. A hobby horse of mine, as Michelle is very well aware, I do worry about the private sector care home, nursing home provisions, and about the financial stability of some of the operators concerned. Are we confident about this sector?
I'll invite Saf in a moment, because Saf's doing some bespoke work with our market care home and our domiciliary care market providers at the moment, and I think that is a significant shift in the conversation that we're having with the market. And I think we've said here previously that there is sufficient capacity. Now, whether that capacity is of the standard that we want, that is a question that we all need to be considerate of. What we want to do in Kirklees is make sure that the provider provision that we do have is of the quality that we want and we need for our loved ones. We know that that's not always the case. SAF is doing work with our Kirker providers, where they are considering what the framework for fees and top-ups will look like, because we want to shift the narrative from, well, you're giving us 3% uplift, this is just off the top of my head, 3% uplift this year. What we want to change the narrative into is, what's the rate for care that we should be paying? And should that be on a framework at different levels, for example? So where you're looking at complex care, what does that mean in terms of a fee rate? Not a percentage up every year, but what does that mean in terms of what you would get for that level of pay? And that will be, that could be complex, it could be medium, it could be low. And what does nursing look like? Do we have sufficient nursing capacity in the system? And what would a fair price and what would a fair rate of pay be for that? And it's a completely different narrative from what we've had previously. Because I think that shows the maturity of the partnership, that we are able to have those conversations with market shapers, market leaders, but also the market that are delivering. And let's not forget that a lot of these providers are businesses, but they are open for that conversation. And I think they are also recognising that it might require them to diversify somewhat, because if they don't agree with the rates of pay that we agree to pay, that is the right rate of pay, then they may not get business from the council. So I think to shift that over the next 12 months is really brave, but it's the right direction of travel for us. And I think we've not been in this space before. And Saf, I'll bring you in a minute. I know he is, I know, because he's done some sessions this week, but I think there is nervousness in that, because it could have gone completely wrong, but it hasn't. So I'll shut up, Saf, and I'll stop stealing your thunder.
No, you've covered it really well. Chair, I think your question to me, the way I received it, is that it's important that we don't ignore that reality of the pressure that the market is faced with, but we tackle it, we action it, and we do that purposefully. One thing for me that's been really important is that market pressures apply across the country. It's not unique to Kirklees. Our conversation with the market is shifting away from, as Michelle has said, being reactive, just talking about price in isolation, more towards what does good care look like and how might the council move into that space of paying a fair price for that care. So a lot of our work has been around strengthening our role as almost a steward of that market, and the market has been very responsive and supportive in that space. I think for me, there's also, and my colleagues share this, a really important role the market plays in terms of the council meeting its statutory duties in line with the Care Act. You know, they're seen as key partners, and we want to work with those sort of providers in the market who work with us in that partnership space. So our conversations have been grounded in honesty, transparency. They want to understand, what are you doing that helps us be a bit more predictable, a bit more sustainable with our businesses. We want to ensure we get the right sufficiency and the quality of care, and I think that's the space that we've got to.
Thank you for that. I think really colleagues have covered a lot of the points that I would have liked to have made, or would have wanted to make. So just really a couple of comments. And the first is that in my interactions with the system, I've been actually pleased with the front door staff. They're unfailingly polite and helpful. There has sometimes been a slight delay in setting plans into motion, but that is understandable. And I do think from what's been said that you are actually looking at speeding that up as far as possible. So that's a compliment for you. There you go, you get some. And in fact, I'll finish. The whole team, you've impressed me this afternoon. Because it's difficult to tread the fine line between showing professional competence and appearing complacent. And you've all managed it. So, well done. So thank you very much for your input. Moving on now, if you wish to leave, please feel free to do so. I've just got a little bit of housework to do.
Okay. Thanks ever so much. Thanks for your time. Thanks for your questions. Thank you.
Right, returning to the agenda, we have one item left, which is the work programme 25-26. Now, I'm a little bit nervous in the absence of the permanent chair, if you like, for the panel. I'm a little bit nervous about interfering with the work programme. So, is there anything that colleagues feel is really important to raise on this issue? I'll start with Councillor Perth. This what, sorry?
No, Chair, that's fine.
Okay. Helen?
I was just going to say maybe we need to, in line with our discussion or the paper that we've been given around birthing centres, whether that needs to somehow make its way back onto the workforce plan as a smaller item, because I think we took it off before because JOSC was had taken that forward, but maybe it's something that we need to just have as a not as high priority item, but something not to let go of.
Right.
It's a suggestion, and we can. It's not urgent. We can decide that later.
It is currently with the JOSC. We've had a briefing today, so I think after the you're having a visit on Tuesday to the Dewsbury Hospital, and I think once you've been there and I know you've got some questions, I think we could feed it back to the JOSC.
Yes, thank you. Sensible.
I'll be back.
No, I haven't got anything to add to that.
Oh, listen.
Me neither.
And I'm certainly not going to interfere with it, so I think that is the final item, is it not? Yeah. It is indeed. So thank you very much, colleagues.